therapies known to man. Hippocrates has talked about the massive benefits of fasting long ago. Historically, nearly every single religion practices fasting. So let's just dive right in. It's very, very important to understand some differences between normal cells and cancer cells. Cancer cells originate from normal cells. What happens is this: a certain thing in your cell becomes damaged, and that thing is called the mitochondria. The mitochondria is the energy factory of the cell. It produces all the energy for your body. And so after the mitochondria become damaged, the body, through an adaptive survival mechanism, starts to switch over its metabolism to a different way of burning fuel. It starts to ferment sugar. And when it starts to ferment sugar and turn into a cancer cell, it starts to become extremely hungry for glucose. Now, it also eats other things, which we're going to talk about, but sugar provides the most fuel for a cancer cell. In the process of a normal cell becoming a cancer cell, it also loses its mortality. In other words, it becomes immortal. So your normal cells actually have a limit. They can only live so long, but the cancer cells live forever. Cancer cells grow faster than normal cells, and they basically take over the body. So the first mechanism of fasting in relationship to a cancer cell is that fasting helps to starve off the fuel. It starves off your glucose because guess what? You're not eating anything. So no eating, no glucose. And so you help to prevent feeding the cancer cell. Now, this was discovered by Professor Otto Warburg, who won the Nobel Prize in medicine. Now, in extreme conditions, normal cells can temporarily ferment sugar, as in a severe infection like sepsis or a severe pathogen invasion in your body, or an intense exercise or trauma. Your body can switch to ferment sugar. So this mechanism is a survival mechanism